Hello everyone, welcome to our channel today. I'm Dr. Hu. Today we're going to continue to talk about mediating formula. So in mediating formula, we're going to discuss in three aspects. The first one is in previous video we have discussed the mediating Shao Yao disease. That's with the typical formula or the standard the example is 小柴胡汤. So today we're going to discuss mediating liver and spleen. And in next video we're going to discuss mediating spleen and stomach. So these are the three aspects we're going to discuss in mediating formula. Mediating Shao Yang, mediating liver and spleen, and the third is mediating spleen and stomach. So today we're going to talk about the formula mediating liver and spleen. As we know, in Chinese medicine we always talk the liver and the organs are connected. So when we see a patient, we see patient as a whole because the organs can affect each other. And according to the 5 elements, the relationship between the organs, the heart, liver, lung, kidney, and spleen, they have internal connections. Especially for liver and spleen, which we're going to talk today, is in 伤寒论 or even in 黄帝内经 it described that the top doctor, the top skilled doctor, we always we treat the patient before they have diseases. So we more focus on prevention. And in 伤寒论 it describes that patients suffer from liver problem. They always will affect spleen, which is digestive system. So for liver patient, for patient affected from liver problem, we need to treat the liver, but we also need to look after the spleen, the digestive system. And spleen is actually all nutrition come from spleen and stomach. So it's actually in Chinese medicine, the spleen refer to the whole digestive system. So all nutrition or qi in Chinese medicine we call it qi and blood. All these are come from spleen. So if someone got a spleen deficiency or the weakness of the spleen function, they will have qi and blood deficiency. In the fundamental theories, we have talked the liver's function is to store blood. So liver doesn't like stagnation. So if the digestive system have problem, it will cause qi and blood deficiency, which is the lack of qi and blood. So it also will cause the lack of blood in liver, which causes the liver problem. And the spleen, once the spleen is weak, it also will cause the deficiency or the lacking of qi, which also going to affect the liver. Because the lack of qi may relate to stagnation. Also for women and liver stagnation are quite related. Also is related to their period. So in our treatment, we need to focus on. We're not only going to focus on the liver stagnation. We also need to think about the weakness of spleen. So we're going to prevent we're going to use some herbs to prevent the deficiency of spleen. The first formula we're going to discuss is Shi Shan. Shi Shan. The name of Shi Shan is very close to Shi Tang. It's only the form from the name of the formula. The ingredients are totally different, but from the name is only the last words, which is the San, and Tang, which is the powder form or the decoction form. The difference. So Shi Shan. The ingredients are 甘草、枳实。Okay, it doesn't work here. It's very simple. The ingredients for 甘草、枳实、柴胡 and 芍药. It describes in Sanhanlun. It is used for Shaoyin disease. The patient may be irritated. The patient also may have palpitation and sometimes have difficulty urination, and sometimes patient may have abdomen pain or diarrhea. So this is the main symptoms for Shi Shan. But from the symptoms we can see what's the disease. Especially in Western medicine, it's very hard to describe what kind of disease it is. But from the symptoms we can see Shi Ni. It's Shi Shan and Shi Tang. They all have the coldness of their hands and feet. So, but the difference from Shi Shan and Shi Tang, the coldness is worse than Shi Shan. So Shi Tang, the coldness can from the hands to your elbow, or from your feet to your knee. So these are the coldness in Shi Tang, but Shi Shan is only hands and feet. So that's one of the main difference from Shi Shan and Shi Tang. The other difference is from Shi Tang syndrome. The patient have the coldness when you touch them. You can feel the coldness become worse and worse. But Shi Shan, you don't actually feel that cold. You can feel cold, but you don't feel as cold as Shi Tang. Also, when you can see from the injection how to use Shi Shan, it is described that you take a small portion of the powder and you take 3 times a day. The dosage of the Shi Shan is actually about 1 to 2 grams each time and take 3 times a day. So as you can see from the dosage is not very heavy, not high dosage. So the symptoms actually not very severe when we use Shi Shan to treat the disease. Shi Shan is one of the main formula for liver and spleen disharmony. So it's the main formula for mediating liver and spleen. And in this formula, there's another main herb for liver. We also use in 小柴胡汤, which is 柴胡. In the ingredients, there are 枳实 and 芍药. 枳实 and 芍药 has the function to harmonize qi and blood, and 甘草 sweets can relieve the pain, and also can harmonize the whole formula. So this is Shi Shan. In Shi Shan, when we see the ingredient there, 甘草、枳实、芍药、柴胡, It is 4. If we take our 柴胡 and 甘草, the other 2, Zhi Shi and Shao Yao, it's actually the other formula we call Zhi Shi Shao Yao San. Zhi Shi Shao Yao San is a formula to harmonize qi and blood we use for abdomen pain, especially after giving birth. So the patient may be irritated. That's due to qi and blood stagnation, and the patient have the qi and blood stagnation. When the qi stagnation there, keep there, doesn't move, it will cause internal heat, which causes irritate. So in this condition, we can use Zhi Shi Shao Yao San. And San and Tang, we have talked many formulas end with Tang. Tang means decoction, and San is in powder form. When we take it, we just grind the ingredients into a very fine powder. Then we take the powder directly with water, or sometimes with wine, rice wine or water, and sometimes with soup. It depends on which formula we. So we got different injections after when taking the formula. Thank you for watching our video today. For more information, you can visit our website. See you next time.